Morning students, today we'll see about upper limb fracture physiotherapy management. Is introduction upper limb fracture clavicle, humerus, scapula, radius ulna, and then the hand fracture. Also, for the upper limb fracture, the physiotherapy plays a key role in the recovery of the cases. Common types are clavicle fracture, humerus fracture, radius ulna fracture, and the Coolidge fracture. And most of the causes of the upper limb fracture is falls, then road traffic accident, then sports injury, then osteoporotic cases. The clinical features mainly for pain is present in the hand region, specifically the shoulder, the elbow. Depends on the fracture site, the pain on the shoulder site fracture, mainly the pain shoulder pain in the shoulder region, swelling around the shoulder region, and the difficulty with the shoulder. The elbow joint fracture is mainly for localized to the elbow joint swelling, pain, and difficulty in movement. Okay, then you'll go for a wrist. You'll go for typically specifically to go for pain in the wrist region, then a swelling present and difficulty in move the wrist joint. Fingers also in the MCP IP joints fracture. This is pain on this side and swelling around this side. Then the movement to the fingers are unable to do the movement is mainly for all the fractures mainly deformities correction. Deformities mainly present is the function is affected for the feature. Then management phase, in the movement phase, three phases: immobilization phase, mobilization phase, and functional recovery phase. Immobilization phase, mobilization phase, then functional recovery phase. Three phases are there. The immobilization phase mainly for is the acute phase, the pain relief phase. Mainly for go for cryotherapy for pain management. Then maintain the range of motion for adjacent joint. The unaffected joints mainly for improve the range of motion for full range of motion. Then affected region will go for isometric exercise. What is isometric? The isometric means is a maintenance of the muscle property without elongation of the movement is it maintain the muscle property. That is isometric exercise for affected group region. Then mobilization phase is go for passive and active associated exercises started for the affected side. Then joint will go for adhesion or stiffness present in the joint. After long-term immobilization period, go for stiffness. It's prevent the stiffness. Go for joint mobilization is used. Joint mobilization technique used for then stretching exercise. Stretching exercise for muscles elongation for this protocol. Then strengthening phase mainly for resisted exercises, then progress to then grip exercise for hand component, and then functional training for aerial activities for hand is mainly for next other components. Then special techniques ultrasonic is TENS ultrasonic mainly for the pain management board for TENS is mainly for the superficial is a spasmic control is where no pain is mainly for TENS is applied. Ultrasonic is a deep heating modality. It is mainly for the deepest touch of the penetrating the heat. That is a kind of the is mainly for ultrasound. Ultrasound is a three frequency, one or three movements. One is mainly for superficial heating modality. Three is for deep heating penetrating the modality. Is for deep the fracture, the bony tissues, the ligaments, the soft tissues mainly for go for 1 megahertz. It's a intensity is mainly for acute is mainly for 0.8 to 1. Right, so the in subacute is mainly for 1 to 1.5. Chronic stage will go for more than 1.8 to 2.1 frequency intensity used for this. Maximum treatment duration that 8 to 10 minutes for the ultrasound period. So better healing for the soft tissue structures, the ultrasound therapy. The manual therapy mainly for the improvement of the movement is mainly for orthokinematic movements. Orthokinetic movements are joint. It's a joint producing the movement of the rolling, spinning movements mainly for manual therapy technique. Then we'll go for osteokinetic. Osteokinetic is mainly for movement producing movement, the flexion, extension, abduction, adduction movements. Then proprioception is any fracture in the conditions will go loss of the proprioception, and that kind of the condition is used for proprioceptive training. This training will improve the movement of the patient. So, what are the complications are present in the fracture cases? First is fractures mainly non-union. It is any the delayed the age process. There is the osteomyelitis, the smokers, the drinkers. These are the patients are mainly affected for a non-healing process of the bone structure. That is a non-union. Then malunion. In case of the without surgery, go for conservative management. The patient is have a main combination of the malunion. Yes, this malposition of the bone fragment is fixed on this fragment, there is a modeling is present. Then the long term is immobilization period, go for muscle atrophy is present. Muscle atrophy is present. There is a long term. Then long term immobilization will go for the joint stiffness is also present in the cases. Okay, these are about the complication of the fractures. Okay, okay, students. Thank you.